Okay, folks, we'll get started as people begin to trickle in. Welcome to the eighth and final installment of Turning Point. The final one. It's come quickly, hasn't it? For those of you who are just tuning in, what is Turning Point? Turning Point is the webinar and podcast series. That's our chance to collectively reimagine New Brunswick on the other side of COVID-19. For those of you who have been with us the whole time, thank you very much for being with us. It's been really fun to have these conversations. I was reflecting on the podcast portion of the experience as well. And I'll give you some stats as to how that's tracking in terms of download. But we've had great listenership. We love that you guys are over there, not only experiencing the webinar, but also experiencing the podcast. So today's really interesting. For the eighth and final installment, we're talking about the social economy. It's an interesting question. What are the unique pressures and opportunities to better serve our most vulnerable people, especially given the situation we're in right now? For those who are just tuning in and don't know me, I'm Matt George. I've been your moderator for the duration of the series. I know some of you are getting tired of looking at my bookshelf. For others, hopefully you see some volumes that you've also loved and enjoyed. And I've loved being with you as well. And with our partners, it's been a lot of fun to produce this. You can follow on social at It's Matt George. So we're recording the webinar. It's going to be on the website after we finish the live event. As I mentioned, we also do record this as a podcast. That's on the Growing Pains with David Campbell podcast. I've had some feedback that it can be difficult to find the link, so we'll make sure you get that wherever you listen to podcasts. It's available on Apple, Spotify, Google, and everywhere else. We'll also post that on the website at turningpointnb.ca. For the very last time, I will be recognizing our partners that have made this experience happen. There's 10 of them. That's the New Brunswick Business Council, Canadian Manufacturers and Exporters, Tech Impact, the New Brunswick Multicultural Council, the Chambers of Commerce in Moncton, Fredericton, and St. John, Conseil économique de Nouveau-Brunswick, the Atlantic Chamber of Commerce, the Pondish Pondé Center at the University of New Brunswick, and our partners at the Government of New Brunswick, and also a COA. For a full list of presenting partners and also a full list of our speakers and facilitators, once again, you can go to turningpointnb.ca. So I really only have two reasons for being. I'm going to set up our facilitators for success. That's why we're here. But I'm also a vehicle for your voice. And with that, I do encourage you to ask questions. We really want to engage with you and make this an interactive experience. To do that, you can use the Q&A function within Zoom or even the chat function to speak amongst yourselves. And some of our facilitators have been gracious enough to engage there in the past. If you're lucky, you may get an answer from one of our facilitators today. So use the Q&A function. Please ask your questions. We curate them and then give them back to our facilitators. And for those that we don't get to, an hour is not a long time for all of this content. We bring them over to the podcast, recognize you by name, and have those questions answered. If we do have a tech interruption, stay with us. We know there's a risk to doing an event live, but the content is very much worth it. So stay with us. We put measures in place to make sure that doesn't happen, and hopefully things go smoothly as they have in the last Turning Point webinars as well. So our committee came up with an interesting framework for these conversations. We wanted it to be impactful. We want to look at some of the realities of New Brunswick. We know there are realities, some we like, some we don't. But we also want to pull out what's useful and design innovation around those things. And I'm going to talk about that at the end of the webinar. I'll take 3 or 4 minutes to tell you what's next, because we certainly don't want this to be the end. This is about action. So the framework is this. It's known as the Four Noble Truths, and we framed it as 4 questions. The first is, what is the pain we're feeling? The second is, what is the cause of the pain? 3 is, how does that pain get better? And 4 is, how do we look confidently to the future? What does that future state look like? And with that in mind, I get to once again introduce our lead presenter for this discussion. That's Herb Emery. Herb holds the Vaughan Chair in Regional Economics at the University of New Brunswick since July 2016. Herb is Program Chair for the J.D. Irving Roundtable on Manufacturing Competitiveness in New Brunswick and Director of the Atlantic Institute for Policy Research. He holds a master's and a doctorate in economics from the University of British Columbia. His academic career began at the University of Calgary, where from 1993 to 2016, he established a track record of excellence in research teaching, and leadership. Herb focuses his research on development of the Canadian economy and the persistence of long-standing regional disparities. Herb, it's been a pleasure to work with you on this project. It's been a pleasure to get to introduce you. And for the final time, the screen is now yours.
Thanks, Matt. Just make sure I can find the right screen. Do you have the right one up there, Matt?
You got it.
Okay, so I've been asked to do some introductory remarks on the social economy. And the first thing I want to note is that I'm not an expert on social economy from an academic perspective or the social economy, but I have done a fair amount of work with social organizations that would be part of the social economy. I've studied volunteer work, and my PhD thesis actually studied the demise of fraternal sickness insurance and the transfer of that activity to the state. So I'm familiar with a lot of the issues that come up. So besides voluntary sickness insurance clubs, I've worked with the Immigrant Access Fund, an effort between the private sector, the Alberta Network for Immigrant Women as a not-for-profit that was aimed at creating low-interest loans to borrowers to help newcomers, to help them get credential recognition. I've worked with the Seneve Foundation in Alberta and NBACL for policies to improve quality of life for adults with neurodevelopmental disabilities. I've done return on investment measures, ROI, for difficult to monetize services such as the Association for Rehabilitation of Brain Injury, which was a not-for-profit working with the most severely brain injured patients in Alberta. We've worked on dealing with financial models and tax structures to address unmet health needs and for sustainable organization funding for groups that are in the social sector. And I'm on the board of Science East, and I participate in meetings and present to a lot of community groups. So I have a familiarity with the social sector, even if I don't technically study it. And one reason it's difficult to study is that there's a challenge in defining it. What you'll find when you look at academic stuff is that a lot of it is around normative dimensions of the economy. So it's defining the social sector based on social justice goals, democratic governance, and autonomy from government. So more of a social collective response to issues. It can also be defined by practical dimensions, which comes down to what is the sources of funding for the organization, what's its corporate structure, is it not-for-profit, volunteer-based, and again, there might be an issue around how autonomous the decision-making is, say, from government. And then the third one, which is probably the most common in the statistics I'll show you, is that it often comes down to it's a residual part of the economy that's just not counted as part of the government sector or the commercial or business sector. And this is where, for economists, it gets a bit tricky because the discussion often moves around, well, where could something be if it's not in the government or commercial sector, and which of the government activities could be better done in another area? Because as we'll get into, if there's time, the social economy actually has much more scope for innovation if you ever manage to resource it correctly. When you under-resource anything, you get a lot of incentive to innovate, but not a lot of means to do it. Now, social economy institutions are often filling niches and gaps left by the commercial sector, so there's no profit to be made doing it, or by government, which has decided it's too expensive to do or there's not a political return to doing it. So I'm going to throw in affordable housing and access to food because we prefer to have those risks carry on in society with decisions we make rather than do something like basic income to get rid of them. We're also addressing services and activities that are difficult to monetize or there's not sufficient public scale or priority for a formal government program. And this is where you'll run into the social return on investment movement, trying to demonstrate the value of doing these things to leverage public money. Or in other cases, you just have a public good that the private market provides some kind of capital or facility. A community can get together and get the funds raised and get the facility constructed or the service delivered. And then there's other cases where you just have some kinds of services that are better suited to private delivery, but they have challenges with finding funding to do their business. The Immigrant Access Fund was an example. Immigrants couldn't get access to capital easily without paying payday loan type rates. Government wasn't really interested in doing it. And so when the private sector agreed to guarantee the principal on a giant loan fund, if the government would do the loan administration costs, the not-for-profit's job was to assess the character and the business plan of the immigrant and give them basically low interest loan that was basically fully repaid. And it's all recouped through the tax system when the government recognizes that their upfront costs, if the immigrant succeeds, can be recovered through increased tax payments over their working life. So it was a great model heading into the Stephen Harper final election. And then it lost some of the traction that it had been gaining under the new Trudeau government because we weren't in the mandate letter. So this is where I get back to the niches and gaps idea, that if you fall off of the radar, you can also lose the momentum on successful programs. I want to highlight Richard Sayon brought Gabriel Arsenault's work to our attention. He's at the Université de Moncton, and I think if you have an interest in learning more about social enterprises in the provinces and around, he is definitely the person to go to. And his argument is that in our province, social enterprises are above all really engaged in fighting against poverty. And so he gives some examples of the different plans that have been coming into place and some of the key initiatives that he identifies, like Social Enterprise Hub in St. John, the Community Accelerator. I'm not seeing the full thing behind my sidebar, the Hub Fund in Moncton. You can also add in things where you've seen lots of attempts to alleviate poverty or big, let's say, collective action, how we can get this going. And when I moved to New Brunswick, there was a lot of effort towards these types of initiatives. The one that really stuck out when I moved here was Living St. John as a branding, but I'm not sure where it's at today. The social economy at the federal level, what Gabriel's pointed out is that the federal government has created a proposal for a $750 million social finance fund to put in place by 2028 to assist social enterprises. That means if we get our share proportion to population, that would be $16 million available to New Brunswick by 2028, which is about 2% of our current nonprofit GDP, not-for-profit organization GDP in New Brunswick. If it's an annual amount. If it's a one-time amount, then it's really not going to be large. So it's not clear at this point if this is a one-time or an annual, and if someone knows, it would be good to have that clarification. But when you see these numbers coming in aggregate for Canada, it looks like a big number, but when you boil it down, it's often sort of marginal funding. It's not like giving $2 billion to a single supercluster for industry. So the social sector doesn't get that kind of money. Now, some statistics from the social economy from Statistics Canada. The first thing I want to note with gross domestic product shares, because not-for-profits in New Brunswick, the expenditures on those organizations amounts to 2% of of the provincial GDP. For Canada overall, it's around 1%. And what you'll notice is that the values don't grow. In the rest of Canada, it's because the social sector is growing in proportion to the rest of the economy. In New Brunswick, the economy is not growing, and our not-for-profit sector is holding its size. Now, GDP is missing a lot of things. It's too low because it only measures things that are transacted in the economy. So it'll get things like a budget spend or actual things that supplies and services that are paid for. It does not include volunteer time. It does not include things like assets that are provided as a gift, or you don't actually have to pay for the rent. It ignores, most importantly, the value of unmet needs. So pain and suffering, which should be included as a deletion from GDP, are not accounted for when we do this. And then one of the interesting ones to think about is that in a not-for-profit and a social enterprise, the budgets are so lean that if this were done in the government sector or the private sector, you would likely have a much higher spend to do the same service. So when you see a 2% of GDP, don't take away from that this is a measure of importance. This is just the value of what we can measure, and that's actually a sizable total expenditure. When we boil it down into employment, we get up to 4% of total employment, and you're looking at around 12 to 15,000 workers in New Brunswick out of our workforce of about 350,000 that are engaged in this type of work. So again, it's a sizable economy even when you just do not-for-profits, and these numbers are missing a lot, so we just know it's going to be bigger. When we bring in volunteering, for example, for New Brunswick, Statistics Canada has valued that in 2013 to be worth about $1 billion, which is about 3.4% of provincial GDP. So if you add volunteering to the previous slide's GDP number, now we've got about 5% of GDP accounted for by the social economy, which is taking us up towards about half of manufacturing and about the same size as the IT sector in the province. And so again, with all of this, we have all this volunteering going on and it's being monetized at probably too low a value. You could make an argument that if we use the actual wages of the individuals who do a lot of this, which can actually be like higher human capital, it could be a higher number, but StatCan will often use a lowest wage available to value the hours of time going in. And one of the things we know about New Brunswick as well is that the amount of volunteering time provided lags Nova Scotia, and it's lower than other places like in Alberta where I lived. So we could have more volunteering, but we don't have as much of it. So just to kick it off around the social economy, there's a big question for economists, which is it the right size? And this comes down to a question of, it can go either way. One view is that government should shoulder more of the responsibility and shrink the social sector, and business-based services as well should be moved out of the social economy. Should more of the social economy be moved to, or sorry, could go either way. Government should give more of its responsibilities to business in the social sector. And in the other way, the social economy services should be moved into government or the business sector to shrink it. And then the third is, if we use strategies like basic income or more reasonable municipal zoning rules, then would we have as much need for the services currently in the social sector? Are the three sectors doing the right things? So what we often see is that government takes on the easy to do things that are routine with low cost, and they've left the big, expensive and complicated and complex things to the social sector. So we might want to look at, do we have that lesson right? And that was something we learned from Arby, was that the government was doing a lot of the low acuity brain injury and moderate, but leaving the most complex cases to charity, which is how Arby was raising a lot of their money. And then finally, how do we create the sustainable and predictable resources for the social economy? And this is where there was a lot of discussion about a decade ago on something known as a social impact bond, which was trying to create a monetized return through a government contract to private sector investors to resource a lot of these organizations. And if they could demonstrate impact, then the government would agree to pay out on the value of the bonds to enable more resources to flow to effective service provision in the social economy. So that's a very high level and naive overview of a very complicated sector. You're going to hear, I expect, from your three panelists that the complexity is not as simple as even the business sector or government, where we have easy silos. Because there's so much heterogeneity in the needs that are being met and the models that are used to deliver services, and also the degree of creativity and innovation in the social sector is probably unmatched in any other part of the economy, because the needs are high and the resources are low. So I'll leave it there, Matt.
Herb, thank you very much for leading us into the discussion. Before we introduce our first panelist, and we'll get Herb to stop sharing his screen as we move forward. Thank you, Herb. We're going to introduce two poll questions. We want to do this as a way to take your pulse. We also thank Herb Emery, who is also our question master for this. So I encourage you, before we get into our panel discussion and have remarks from our first panelist, I do encourage you to take a minute just to quickly reflect on those two questions in front of you on the screen. A reminder to use your Q&A function below to ask any and all questions, and we'll review the results of the poll when we come back together. So I have the pleasure of introducing our first panelist. It's Karina LeBlanc of the Pondish Pond Center. Karina is the executive director of both the Pondish Pond Center at the University of New Brunswick and the New Brunswick Social Policy Research Network. With a passion for supporting the growth and development of motivated systems change makers, Karina is invested in fueling the growth of the impact economy in Atlantic Canada and creating the connections between sectors necessary to drive evidence-based public policy and programming. She's working to build a more equitable and sustainable economy with the creation of such initiatives as New Lab, the B4 Change Social Venture Accelerator, the Changemaker Seed Funding Program, and the New Brunswick Social Innovation Research Fund. Karina, welcome to Turning Point. We're very lucky to have you. We encourage you to unmute, give your first reflections on the work that you're doing, and also some of the things you've heard from Herb. The screen is now yours.
Great. Thanks so much, Matt. Really appreciate the opportunity to be here today with everyone. And I want to thank Herb for his opening comments, and also validate how difficult it is to quantify and describe the social economy. I've had the privilege of working in this space for the last decade, and have realized as time goes on that there's more and more complexity and more layers within it than anything else I've ever worked in, which includes both public and private sector in my career. So as Matt mentioned, I'm the executive director at the Pandeshpande Center, and I thought I'd talk a little bit first quickly about what it is that we do to provide some context for my comments today. And so PDC is located at the University of New Brunswick, but we are very focused on building stronger, more resilient, more prosperous communities across New Brunswick and the rest of Atlantic Canada. And we do that in a couple of ways. We're very focused on the fact that in order to create that resiliency, we need to deal with complex socioeconomic challenges at a systemic level. So we've talked a lot about the Venn diagram that Herb presented today that shows these circles overlapping in terms of the way we define our economy. And as we all know, the systems that we design are multifaceted and multi-sectoral, and being able to unravel the big challenges that we face today means looking at problems as systems instead of thinking of them in very siloed ways, which we have tended to do in the past. We also have an underpinning of an entrepreneurial mindset under everything that we do. It's in our DNA. It came from our founders, Jerry Pond and Dash Deshpande. And we use it as a vehicle to look at problems as opportunities and to use the cycle of ideation, prototype development, and experimentation in order to find the right solutions to fix the problems that plague us. We're very focused in the social economy and have been from the beginning. And as we've done this work over the last decade, as I mentioned, we've started to uncover that a lot of the reasons why we have these challenges are because of the way systems have been designed. So Matt launched this sort of framework of the Four Noble Truths. And the first question is, what is the pain? And if we look today at the situation that we're in with COVID, the racist underpinnings of the conversations that we're having, and the fight for more equity and inclusivity in our society, these are all outcomes of poorly designed systems. And so when we go back in time and we try to understand systemically where we came from, then we can start to understand why did this happen and how can we do it differently going forward. And so I just wanted to make a few comments about the fact that our systems were designed by a handful of people that all looked alike, sounded alike, were educated in the same way, and had the same perspectives. And so the systems were designed for them in order to benefit them. And as we can see, has left out a large swath of our population as we move forward. And when we become vulnerable, when we become weak, we can see how this disproportionately affects others. And so the goal is, in the social economy, to figure out how do we convene more voices? How do we get more perspectives in place so that the decisions we make around how we design our socioeconomic models are more inclusive and that we have everybody at the table, and that way we can create more resiliency. As they say, a society is only as strong as its most vulnerable. And so we need to reframe and flip the pyramid in terms of our economic models so that we think about how does this affect our most vulnerable rather than how does this put as much wealth back into the pockets of the few, which is the model that we've been sitting in. So I go back to Herb's Venn diagram very quickly, and we need to make decisions in the middle of that diagram where the public economy, social economy, and private sector economy overlap, whereas we've been making decisions in the outside in very siloed ways. So I want to leave you with two big places where I think we can focus on for New Brunswick and think more systemically. One is this idea of universal basic income. So we've seen how we've had to subsidize, large swaths of people through COVID, and it started to raise the concept of how can we blend the social assistance programs, EIs, programs, and others in a universal basic income. And New Brunswick is uniquely positioned to have this conversation and maybe even test it, because we're small, closely connected. We have links between those who are on assistance and decision makers that are much tighter than in other jurisdictions. The second one I want to leave you with is food security and food supply. It's probably one of the biggest potential pain points that we have seen in this COVID situation, of how vulnerable we are and how little food supply we have in our own province. In the 70s, about 97% of the food we ate as New Brunswickers was grown here. Now it's about 6 or 7%. We have the land, it's available. We need to put policy and programming in place that will stimulate and motivate our young people to get back to farming the land. And we need to create tighter connections between that production, our private sector, and our social economy to understand all of the potential possibilities and benefits of doing that. So I want to just leave those two big ideas as things that New Brunswickers can tackle at a systemic level that brings all the sectors together. And I'll leave it at that, Matt, because I'm really curious to hear about our next panelist comments and the Q&A at the end. Thanks for having me.
Karina, thank you very much. We certainly want to be thinking throughout the course of this experience at systems level change, community level change. So we certainly will dig into that in the discussion and the podcast. And now that the cat's been let out of the bag twice now in this conversation, we'll certainly be digging into UBI as well. So thank you very much for being here. We'll move on to our next panelist and have you back soon for a panel discussion. Our second panelist, welcome Tim Ross. Tim is the Executive Director of the Cooperative Housing Federation of Canada. CHF Canada is a national membership association of housing cooperatives, representing over 1,000 members and home to over 250,000 people. Tim's is a nationally recognized nonprofit, community, and cooperative housing policy expert. Through his work with the Cooperative Housing Federation of Canada, he's forged partnerships across the housing spectrum and has been a leading voice towards the creation of the federal government's national housing strategy. He's also founding president of the Community Housing Transformation Center, a $68.6 million pan-Canadian initiative designed to drive transformation, sustainability, and growth in the nonprofit and cooperative housing sector. Tim, welcome to Turning Point. We encourage you to do the same, to reflect on what you've heard from her, but also to tell us about the good work you're doing. The screen is now yours.
Thanks so much, Matt, and good afternoon, and thanks for the invitation to join the Turning Point series. I'm actually speaking to you in Ottawa today. I'm on unceded Algonquin territory, but I have deep personal and professional roots in New Brunswick, and it's very humid here today in Ottawa, and there's nothing I'd give just about anything to be able to take a paddle down the Nashwaak River today. I grew up in Stanley, and the river was really nice to be close to. So in terms of building on what's already been stated about the social economy, the pain that we're feeling, that I'm most interested in talking about, is people's housing pain right now during COVID-19. The WHO gave a very simple, straightforward prescription to reduce the spread of COVID-19 while we're waiting for a vaccine, and that's stay at home. So what if you don't have a home, and what kind of pain are you feeling if you don't have a home? So finding and keeping an affordable place to call home is integral to social and economic inclusion, and it's even more evident now that good housing is also integral to our health. People need affordability, security of tenure, and a strong community as key ingredients in terms of having a good place to live. And in New Brunswick, we need to start by recognizing there's already a housing supply and affordability problem. There's about 74,000 renter households in New Brunswick, or approximately a third of all households in the province. And housing is considered affordable if you pay no more than 30% of your income on rent and utilities. And today in New Brunswick, about 4 in 10 renter households are struggling to find and keep a place to rent. So in New Brunswick, there's both a supply problem and an income problem when it comes to housing affordability. So there's also just something that I did want to address too, in terms of how we frame this conversation, and I think the subtitle of this event today is how do we better serve our most vulnerable? And I think we really need to challenge ourselves and recognize that. Um, in building on what Karina said in terms of looking at a systems approach, is how have the vulnerable been serving the comfortable, right? Through work that doesn't allow someone to earn a living wage, uh, through through uh, uh, through racism and oppression and discrimination, and we really do need to be actively anti-racist and work with an anti-oppression lens to really dismantle the system that is leading to really unequal outcomes in and uh, 2 years ago, New Brunswick some New Brunswick cities participated in a point in time count to conduct an enumeration of individuals experiencing homelessness. And a count took place in Fredericton, Moncton, St. John, and Bathurst. And there are about 500 people who were enumerated through that point in time count. And that's just a sense of who's visibly homeless in a community. There's also a lot of hidden homelessness in communities, and point in time counts don't accurately count women and girls and children experiencing homelessness and housing vulnerability as well. But if one statistic really stuck out at me, you look at the population in New Brunswick that's Indigenous, and it's about 4%. 23% of the people enumerated in that point in time count in 2018 were Indigenous or identified as having some Indigenous ancestry. So that's a vastly unequal and unacceptable housing outcome. And this exclusion is simply untenable from a human rights standpoint, but it's also quite costly as well. We know that individuals experiencing chronic homelessness in Canada can consume upwards of $100,000 per year in different emergency and institutional service interventions, whereas housing and housing supports and a basic income are much more affordable and appropriate in helping to deal with root causes of homelessness. Um, I hope I get to talk a little bit about housing co-ops in the Q&A. They're affordable, attainable, sustainable, and they're democratic, and they're nonprofit organizations across Canada that collectively represent a 250,000 people and a real estate portfolio of about $6 billion. And so one thing that we've been saying at CHF Canada is, how do we put housing at the center of the social, economic, and health recovery to COVID-19, and ensure that we're building more non-market affordable housing, such as nonprofits and housing cooperatives, as a way to ensure everybody has an opportunity to more fully participate in the economy and in their community. Housing co-ops have been weathering this storm quite well, all things considered, and because they're pre-made communities, neighbors are helping each other weather this storm, and arrears have been quite manageable. People are still paying their rent, but we think this is largely due to the availability of the CERB. So now, some provinces, including New Brunswick, have started to allow evictions to occur again, and I hope that we have some time to talk about that, because everybody needs to have a decent place to call home in order to participate fully in their community and their economy. So I'll leave it there, Matt, and love to hear from Haley, and we'll get some discussion going too. Thanks.
Tim, thank you so much for your opening remarks. We're definitely going to make sure we hit on some of those take-home stats, and also the past success and future success of co-ops as well. And given the light of COVID-19, we'll certainly be discussing more as we go. Thank you very much for your opening comments. Our final presenter, Haley Flair of Ability New Brunswick. Haley Flair has served as the Executive Director of Ability New Brunswick since 2006. She has over 20 years of management and administration experience in the nonprofit sector, specifically with health and disability sector organizations. Haley believes strongly in the value of the nonprofit sector as New Brunswick's third economic pillar. I know we'll be discussing that. Haley is a community developer with extensive experience in program development and evaluation, a passion for social policy and community-based research, and serves on several government committees and boards related to health and disability. Haley, thank you so much for joining Turning Point. We invite you to give your opening reflections on what you've heard so far and the good work you're doing. The screen is now yours.
Thank you so much, Karina and Tim. Love that you've opened the discussion about housing and guaranteed annual income, and these are huge topics that need more action in New Brunswick. So I have a lot of biases about the nonprofit sector, but I wanted to talk a little bit about that today. Because in terms of pain, the sector is feeling it. I hear it from my colleagues and our sister and brother organizations. You know, we've long passed, I think, the myth where, you know, working in the nonprofit sector meant, and my dad still believes I do this, but people out front of the legislature burning bras. You know, I really believe that we've moved. My dad fully supports my work, but he still has this very traditional vision of the nonprofit sector. But I think we've turned that corner, but I still think there's this great nonprofit myth about what actually happens in the sector. Charities are facing billions in lost revenue from sponsors, events, donors, disruption to essential community services, and massive layoffs. We've seen them in New Brunswick as well, disproportionately impacting women who tend to be the primary workers in the voluntary sector. This is Imagine Canada data saying that Canadian charitable sector is projected to lose about 15.6 billion in revenue and about 194,000 employees throughout Canada. The pandemic has been an opportunity for nonprofits to shine and do what we do best. You know, we work with the most vulnerable populations. Our organization works with those with a mobility disability, which is about 73,000 New Brunswickers. New Brunswick has the second highest rated disability in Canada at 26.7%, the oldest population in Canada. So we need those lenses on everything we do in New Brunswick in terms of social and economic policy. The pandemic has created for voluntary organizations the need to be even more vigorous and work harder and even more creative because we had individuals that were dealing without their typical systems of support, home support workers, friends, family, neighbors, less people to help them with food security, preparing meals, provide nutritious food. There were safety issues, risks of falls and accidents due to less support workers available in the home, lack of transportation, the need for groceries, meals. Our food banks are a wonderful resource but for our population with chronic health issues, we had to buy a lot of whole chickens and a lot of eggs and a lot of vegetables and things that weren't available. And the navigation of programs with all the different layers of benefits, et cetera, that have been added has been something we've had to really step up. We did a lot of curbside meetings during the pandemic. So what's the cause of some of these pains? There still is a lack of recognition in the charitable sector as a really key economic pillar. We're significant employers, we're good fiscal managers. I can't run deficit or the organization shuts down. It was one of a client, a person with a disability that I worked with years ago, that I was sitting around a kitchen table in his home with a dirt floor. You know, his home was a dirt floor home, and he told me, I asked him about our services and, you know, what's good about them and the other organizations you're working with and what needs to improve. And he looked at me and said, if the arse falls out of the nonprofit sector in New Brunswick, the arse falls out of New Brunswick. And that's always resonated with me, and especially during the pandemic, where I've seen incredible nonprofit sector organizations step up to provide food, medications, transportation, emotional support. Herb's GDP numbers, you know, they're accurate, but they aren't the whole picture. And I really believe we need to do some more research into that. I sit around a table with 10 provincial disability organizations, and collectively we employ 400 staff in the province. You know, that's a huge employer, over 1,000 volunteers, over 100 programs and services. Some of the other challenges are a lack of social policy lens on economic initiatives. You've probably heard me doing some yammering about the essential worker top-ups in the province, where initially private home support support workers were going to be left out of this. We're now in New Brunswick looking at analysis to fix that. But that's about 50% of home support workers in the province, we have a home support worker crisis in the province. We can't afford to alienate that population who can make more in fast food service delivery than they can being home support workers. They're caring for our most vulnerable. They're working in rural communities. They're providing ostomy care and catheter care and personal care. So, that was just an example of we really should have looked through that economic lens of asking the feds for this essential worker top up, made sure we were including really key populations, because the economic impact or fallout of alienating private home support workers would mean every hospital, every long-term care home, every special care home teaming. I've been around long enough to see when, I won't name the government of the time that eliminated evaluation departments and government departments. I have a Calvin and Hobbes cartoon on my wall that's basically them sledding down a hill, and there's a tree, but they say if you acknowledge the problem, then you got to do something about it. So it just always reminds me how critical it is to do evaluations of programs and services. And we're the ostrich effect of just not evaluating to see how we can provide better labor market services to people with disabilities, or better case management to move people with a disability into employment. We need to be looking at these things. We also have a huge untapped labor pool sitting right here. Stats Canada says there's 15,000 working age New Brunswickers with a disability that have the potential to work right now. But our case management programs, when I say about ours, the global we, are failing. And this is a huge untapped labor market pool that is ready, willing, and able to work. So how does the pain get better? Not a negative, Nellie. We need to get priority populations involved in pandemic planning. Yes, New Brunswick did a great job in reducing transmission, but we didn't do a great job in helping our most vulnerable. Other provinces stepped up to help individuals with the costs of cleaning supplies and home support worker shortages and nutritious foods. And we really pushed people with a disability and single parents are the most in poverty in this province. And we've pushed them further into poverty in the last few months. The nonprofit secretariat in New Brunswick, if you remember the Claudette Bradshaw report, the secretariat failed. It was supposed to be a liaison between nonprofit and government. And I think we can resurrect it, or have nonprofit liaisons in the executive council office or in each premier's office to help make sure there's that link and liaison with the sector on social policy and program service delivery. We need a greater connection because there's a lot of creativity and innovation out here. And I would say the nonprofit sector responded better than our government social services to helping the most vulnerable, because we're nimble. We got to those curbsides right away. We had cell phones, we had laptops, thanks to corporate donors. So we were able to get home and still be able to reach people. And the untapped labor market, there's Watch for Ability New Brunswick and Tacit Elements are releasing a study at the end of this month on the economic impact analysis of disability and employment. First ever time this has been done in Canada about the labor market participation of people with disabilities. And it's talking about, you should see some of the initial findings. There's the potential for 1.38 billion in total annual labor income and 1.97 billion in total annual GDP by getting to work, getting coordinated with government and nonprofit sector to get people into employment. So I'm really excited about those results. It also shows about 220 million in annual provincial potential tax revenue. So how do we look confidently to the future? I'm a community developer, so as much as I learned at University of New Brunswick, I learned more from the people we work with. And I was given these glasses by one of my clients to say, any bad day, the future's so bright, we got to wear shades. And I keep them on my bulletin board because New Brunswick is the potential to be the think tank, the test tank for guaranteed income supplement. We have the opportunity to be leaders in affordable, accessible housing and leaders in innovation with the social sector. I think definitely the nonprofit sector can do more, do it better and more nimble in government in several areas. Thank you.
Haley, thank you so much. There was no way I was interrupting that. That was excellent. As we invite the rest of our panelists to come back, and we're going to invite Herb back as well for panel discussion, before we introduce the polls, we won't do that quite yet. I want to stick with the elephant in the room. It's something that we've been discussing this entire time. Where do we go from here given COVID-19? And Haley, I want to stick with you. You said some things that I thought were really interesting. You've said the nonprofit sector is the third pillar. You mentioned that you can't run a deficit or you shut down. That was really interesting to hear. We know COVID-19 has been traumatic for a lot of people. Has it presented any opportunities as well, or do you still feel like you're treading water?
There's been some incredible opportunities and partnerships. Like one of the things, we were begging, our social development partners to look at some flexible funding to fund electric can openers and reachers and sock assist devices for people that had less home support. And the United Ways in New Brunswick really stepped up through the Atlantic Compassion Fund. They have funded all kinds of these type of devices for people. They funded convection ovens for people that had difficulty using a typical oven and had less home support. So that was one of the real opportunities. None of it went to administration. It all went to service participants. We delivered things to people's home, got things that people needed. So there has been some significant funding opportunities, and I'm really proud of that one, that none of that was staff wages. It was getting things out to people that needed things the most. And we funded bath chairs and grab bars and things that were going to be delayed for 6 to 8 months because our systems and government were struggling to learn how to work remotely.
Thanks, Haley. And there's a lot of things I want to discuss on the podcast. Things like there being a gendered and racial lens to a lot of these issues. And Tim has mentioned that as well. And I believe you as well, Karina. So that's something we sincerely need to be aware of if we're going to make systems level change. And we'll discuss it on the podcast. We'll hash it out in long form. Karina, same question for you. Once again, I know COVID-19 is first and foremost a health crisis, but has there been opportunity? Is there momentum now to change systems we previously didn't get to?
Yeah, it's a good question. It's kind of like, are we going to go one way or the other? Are we going to race back to the way we always did things because we're terrified and we want to crawl under a rock because of what has happened? Or do we feel energized to create change? And so, I mean, I'm happy to report that, the people we work with, both public and private sector partners, are kind of speaking the language about reimagining New Brunswick, transformation, creating new and better systemic change. So I feel like there's in the air, there's a desire to do better. We know we can do better. And I think we understand why we haven't been able to. And so we just have to keep the momentum going. But that means taking these conversations, understanding the data that's coming from them about where do New Brunswickers want us to focus our time and energy, what will be the biggest, most beneficial places to focus, because we're going to have limited capital and access to resources post-COVID. So they have to be very laser focused. But we have to agree across sectors. It can't just be the private sector talking about what they need. It has to be a collection of public, private, and social combined together about what do we all need and what will benefit all of us. So I'm optimistic. I think we're going in the right direction, but now we need to start making these decisions together.
Yeah, you and Haley both mentioned the opportunity to collaborate right now. We started this series with Premier Higgs, and he mentioned as well that the door between New Brunswick and Ottawa and the rest of the provinces and territories has never been more open. So hopefully that continues to be the case, and collaboration is the name of the day. But I know lots of people in this province are weary of these kinds of conversations if they just stop. We have to ensure that even if we're digging into the realities of the province, we're translating that into those 80-20 innovations that are low-hanging fruit that we can continue implementing. We don't just have to go back to days of old. Tim, you reminded me that I've repeated to myself multiple times throughout the course of this pandemic that I feel like a COVID 1%er, in the sense that if you're building a tech-based company, this has been opportunity. I have a fiance who's in management in the social economy, so her job is set in stone. We didn't feel a lot of hurt other than worry for our community members, and that sucks because you can't empathize. But I'm also on the board of the Human Development Council, and we do a lot of work on housing. And that was an underrated thought for me, that housing right now, things like social distancing, PPE, that must be a nightmare. What is the housing sector experience throughout the course of COVID-19? And same question, is there any opportunity or light we can see now that we're seemingly coming into the other side of it?
Great question, and probably a good, I mean, a lengthy answer on that would be it's different depending on the housing type that you're talking about. So in Canada, you know, we have a community housing sector that's about over 600,000 units of what's community housing. So it's owned by non-profit enterprises, public housing, or cooperative homes. And the housing that is more focused on individuals experiencing poverty or different levels of ability, in supportive housing, where there are a lot of challenges because the ability to get supports to individuals has been significantly disrupted by COVID-19, and people are working very heroically and compassionately to make sure that those levels of support are still there. I'm really in an exceptional circumstance as a spokesperson for cooperative housing in Canada, because we as a sector have been quite resilient through COVID-19. Individual members in housing cooperatives have either retained their employment, or their incomes have not been disrupted due to the availability of things like the CERB, for example. And so and co-ops are also ready-made communities. So we're seeing great stories of people organizing to help neighbors with groceries, checking in on elderly neighbors, helping to make sure that individuals with disability are getting access to transportation and services and other needs. So the close-knit nature of co-op communities, they're demonstrating a resilience, and so that's quite remarkable. So I'm not asking for any sort of government intervention or support to secure the future of cooperative housing right now. But I think what needs to be really closely monitored and closely considered is there's people who's falling behind on their rent, right? And why are they falling behind on their rent? And how do we make sure that no one in this country is evicted due to the economic circumstances around COVID-19? Because we are like Canadians are, we have a generous society, but we really need to understand who's falling behind on their rent, to make sure that these arrears don't turn into an eviction, don't turn into homelessness. And we also need to ask ourselves, who isn't adequately housed today and why? Those are the questions that we really need to ask.
Yeah, I can't wait to hash that out on the podcast, because I'm guessing that at some point, unless there's intervention, that those eviction moratoriums do have an end date. And so if people aren't saving, we're going to have a big problem, unless we can find a way, like you said, to get something into legislation where that doesn't happen. Herb, quickly to you before we introduce the results of the poll, and I tell everyone what hopefully comes next out of this turning point experience. When Richard Saillant talks about the buffer that the region had from COVID-19 because of the size of the public sector and the lower size of the private sector, do we include the social economy in the public sector bucket, or is it more like your graph where we kind of miss it and don't count it?
And I think the way to look at it is from a financial perspective alone, it's the most precarious sector of the economy. And it's the easiest to fall behind when government makes priorities for what they're committed to paying for versus what they need to pay for. We have challenges as well, that what you really need to do to activate the full capability of the social sector is, how do we get more people like yourself actively engaged in like putting significant amounts of mental energy into solving Haley's problems or helping out? That's where we haven't seen the response yet. And in part, it's because we keep waiting for a CERB, we keep waiting for government policy. But suppose it doesn't come, and we know that we're going to have a lot of people in need. We're going to have lots of challenges even dealing with unpaid utility bills. So even if I lose my house, I can't get the next one. So we have to just start having a conversation about the social sector needs to communicate that it's not like the public sector. You're not doing the easy to do mass program stuff. You've got huge heterogeneity in your population. You've got very big differences in needs and circumstances, and it's going to require a different way of thinking. So think about government learning to multitask, which it's not great at.
Mm-hmm.
Think about, if there's a lot of comments about multi-sectoral approaches or cross-sector. how are we starting those conversations knowing that we're going to have to think about a different way of getting the social sector on sound financial footing so that it can do
Mhm.
what it's supposed to do or capable of doing? And
Yeah.
that's what I'm not seeing yet. Just this is a great conversation we're having, but I don't know if the provincial government has reached out and said we got to get together and talk about
Mhm.
what are the 5 most pressing priorities coming out of COVID and what are we going to do about it. Where's the
Yeah.
business sector come in? It starts with relationships, and maybe that's what needs to start building immediately through the turning point.
Yeah. And again, I can't wait to have this discussion and hash it out on the podcast. But very quickly, we're going to introduce the results of the poll. Thank you very much for our participants in the audience and taking part in that poll. The first statement was the social sector in New Brunswick is, and the majority of you, 41%, said as large as the IT sector. When you look at that breakdown, Herb, how did we do? Did we come pretty close to understanding the size of our social sector?
Well, I think in pure measurement, I can justify it's as large as the IT sector, but to Haley's point, that's an undercount. But if
Mhm.
you're trying to say how important is this sector, and we like IT, it's a big sector and it's important.
Mhm. The second, the social sector is, and the number one answer, 37% of you said too small because the organizations and efforts in the social sector are perpetually, precariously, and deficiently resourced. In this area, there's a lot of experts who talk about this exact thing, the Mother Teresa complex, that if you're in the social economy, you're overworked and underpaid. And that's something that I think can change as a result of COVID, or at least I hope. Any reflections on that poll, Herb?
Well, again, that's the easiest one to pick because it's true.
Mm-hmm.
But the other ones I want to highlight in there is that people are also picking up that we have too high a need to meet because we have fixable problems that a basic income, better housing policy could address. So I don't want anyone to miss that there is a lot of people who answered the other ones because it's picking up. This is complicated.
Yeah.
Where the easiest one to pick is we could do more with the organizations we have, but society can do more to make it easier for the organizations as well.
That's a good point. 20% of the audience said too big because government fails to meet all the needs that it should, leaving more on the social sector's plate. 17% too big because inequality in our society results in unnecessarily high levels of needs. And maybe just a reflection on the lowest percentage. I think it's interesting what people don't choose about the right size, since the social sector represents an admirable and adequate community response to pockets of need. That was 6% of our audience. And I will bring that over to the podcast so we can have some reflection from our panelists as well. And with that, we are going to go over there. We have tons of great questions. We're going to be going over to the podcast as a group in just a few minutes. We're going to be releasing the podcast tomorrow morning on the Growing Pains with David Campbell podcast, one of our flagship shows. I will make sure that the links are clear and how you access that show. As a wrap up, I want to echo what Karina said. We have to build on this momentum. If we don't do anything about the conversations that we've had, they may end up meaningless. We need to translate these discussions into action. What are the things we can pull out, have our partners knock heads on, and get them onto policy room floors, or at least more in the public discussion? And I also want to express gratitude for you being a part of not only this Turning Point session, but all Turning Point session. We have some really interesting numbers for you. We had 10 funding partners. As we all know, it's a great collaboration. We've had more than 750 people tune in before today. We'll tally the numbers for today as well. And the podcast is approaching 1,000 downloads throughout the course of these 7 released episodes, and now the 8th coming tomorrow morning. So we're seeing that you're interested. We're seeing that you're interested in what comes next. And I know I've had a lot of direct messages saying, we certainly need to ensure this translates into action. And let me tell you, we do hear you loud and clear. We want that to be the case. So thank you to our funding partners. Thank you to all of our panelists. Thank you to our 3 lead facilitators, Richard Saillant, Herb Emery, and my podcast partner in crime, David Campbell. And thank you all for tuning in. You are what's most important about this initiative. You will decide what comes next. Thank you for letting us take your pulse with our questions and our polls. We're going into the podcast now. And again, that comes out tomorrow morning, where you can hear our panelists discuss their expertise at length. Thank you so much. This has been Turning Point. We really appreciate you, and we'll make sure to let you know what's coming next. Thank you very much for being a part of this experience.